My video on microneedling seems to have been quite popular with you all, but I said in it that you should consider avoiding it if you have pigmentation with regards to the technique that I showed in that video. However, so many of you asked for pigmentation advice in the comments that I decided I've got to show you how to microneedle when you do actually have pigmentation, because you can do it. I need to share with you some words of caution though first, so you can look after yourself as well as possible when you're doing it. Don't overdo the needle depth. I'll explain why in this video. This method requires skincare in combination with the needling for ideal results. I don't sell skincare, so I have no bias for brands, and I don't work with any skincare brands either. Pigmentation is multifactorial, and it's not just about the skincare ingredients that you use. Diet's going to play a huge role in skin health as well as things like, say, medical history, age, hormones, etc., etc. That's why the same product can give two completely different results for two completely different people. I'll talk to you about ingredients, which ones you can use, and how to use them in this video as well. Now for the technique, it's the same as the previous video I did, so I'll overlay that on the screen here as I talk. If you want to hear me describe it, then you can look at the previous video before this one for some commentary as I dermaroll. The main difference though is that the needle depth needs to be much less. It's going to be about 0.2 to 0.25 millimeters. You really need to understand why though, so you don't cause pigmentation to get worse, because the needling itself isn't going to reverse the pigmentation. It's how you combine the needling, which is what I'll go through today. The link to the roller I use is in the description below for both Amazon US and Amazon UK. Please be aware that these are affiliate links now. I've decided to use them because I'm starting a podcast and the equipment is burning a huge hole in my wallet. If you want to buy without the affiliate link though, that's perfectly fine, and you're very welcome to do so because no one's forcing you to use the link below. So in the skin, we have two main layers called the epidermis and the dermis. Between them is the dermoepidermal junction, sometimes called the DEJ. If you break through the DEJ, then the body starts a cascade of events in the realms of wound healing, which is how we can induce collagen to be made. When you don't break through it, it's like just getting a splinter in your finger when you touch some wood. You can just pull the splinter out and nothing's happened because it's only gone into the top of the skin at the epidermis and not broken through the DEJ. In fact, in the DEJ, we have structures that trigger things like blood clotting when a layer is broken into, for example, by a needle from above, a bit like an alarm system that's triggered. And if you make a hole through the DEJ, the pigment that's sitting just above it could potentially fall inwards, which is why you shouldn't go too long on the needle depth. However, we have the pigment sitting just above this junction, and that's why we're not going to go beyond 0.2 to 0.25 millimeters. That depth allows us to reach a specific target. The layer where the melanocytes are is the layer where all the pigmentation comes about. So when you needle at this shallow depth, there's not really any mechanical collagen induction going on because we're not breaking through the DEJ. What we're doing instead is two things. Number one, we're improving the communication between the pigment cells, called melanocytes, and the stem cells in the area called keratinocytes. Now, this communication improvement can help the pigment be spread out more evenly. Number two, we're creating tiny entry funnels for a higher amount of our skincare ingredients to enter into the skin. That's the key that allows us to treat the pigmentation. You see, when we rub skincare in with our hands, we probably get something like 7 to 8% penetration of the product into the skin, depending on which scientific paper you read, of course. When we needle with, say, 0.2 to 0.3 millimeters first, though, for a few minutes, we can increase that penetration to around, say, 4 to 8 times more of the product going in, depending on variables like depth and product use. I'll link a paper that shows that in the description below. So to summarize so far, we're not trying to induce collagen production or stimulation. We're only trying to stay in the upper portion of the skin where the pigment is. If we go beyond it, then we can let pigment fall deeper into the skin. The 0.2 to 0.3 depth allows our ingredients to penetrate multiple times more into the skin, and shallow needling at this depth is just a way to increase skincare penetration, and deeper needling, like in the previous video, is a way to induce collagen production by means of triggering wound healing processes. And that's how we can microneedle for pigmentation safely, by sticking to skincare penetration depths instead of collagen induction depths. But you do need to use needling in a really particular way with the skincare. The important thing is to make sure that the skincare is applied literally immediately after the needling has stopped, because the holes are going to be repaired and closed up again. I'll put a picture from the paper here so you can see what the hole actually looks like as well. And guess what? It's not some dramatic tear at some weird angle like most people lead you to believe so they can sell you an expensive needling pen or in-clinic treatment with one of those automatic pens. It's a perfectly reasonable and straight puncture that causes a completely healable and tolerable entry into the skin for the ingredients that we then use, and with no scarring side effects at all. So then the question is, well, which ingredients do we use? Well, personally, I get my patients on prescription strength products if they can afford it, so we can treat the pigmentation in weeks instead of years. Now, I might use ingredients along the lines of, say, hydroquinone, niacinamide, tretinoin, adapalene, things like that. If you're trying to do it with weaker ingredients available over the counter, then look at things like, say, thiamidol, vitamin C versions, azelaic acid, things like that. They're all decent starting points, but I tend not to use them too much because I find that it just takes longer because they're not as strong. However, the most important thing to realize about treating pigmentation is that skincare is actually just one factor. Diet and lifestyle are huge factors in the same equation. And as well as that, if you don't do well in things like, say, using sun protection, keeping the skin clean, keeping the roller clean and replacing it now and again so it stays sharp, staying consistent with this technique every day for maybe 2 to 5 minutes, then your results aren't going to be as good as they could be. People even underestimate greatly the power of diet in my personal clinical experience and opinion. And as well as that, remember that this video it's a generalization. Individual patients that I see have individual problems, needs, medical histories that makes me tweak this technique to make it work for them. And I can't do that for all of you watching this for obvious reasons. But if you are interested, I actually get my patients to slowly move from skincare penetration needling like this to eventually the collagen induction needling from the previous video. And we then combine that over time with really powerful prescription strength ingredients. So we then have very high penetration with very high strength ingredients together for huge improvements in tiny spaces of time. That's a more complex pathway that needs to be done always on an individual basis though, and I can't give a generalized plan for something like that in a video that's aimed for the general public like this.